The thyroid lies below the Adam's apple along the front windpipe. The thyroid cells are the only cells in the body that absorb iodine. Its job is to secrete thyroid hormones, the main ones being thyroxine, or better known as T4, which has a large influence on metabolism, growth and development, body temperature, heart and muscle function, etc. And also T3 hormone, also known as triiodothyronine. The pituitary gland is directly connected to the thyroid gland in that it signals the thyroid gland to produce T4 by thyroid stimulating hormone, or TSH for short. Having too much T4 causes hyperthyroidism, and too little causes hypothyroidism. In this video, we will be discussing congenital hypothyroidism. More specifically, we will discuss what it is, causes, symptoms, screening and treatment, mechanisms, and studies. What is it? Congenital hypothyroidism, or CH, is seen in babies at birth caused by deficiency in the T4 hormone. This occurs from a defect in the thyroid gland anatomy, an error in its mechanism, or from iodine deficiency. This can be transitional or permanent. Defects in anatomy, also called thyroid dysgenesis, account for 85% of permanent CH cases. This normally occurs during embryogenesis, while defects in thyroid hormone biosynthesis account for about 10 to 15% of CH cases. Normally, this is caused by genetic mutations present during development of the thyroid gland. Iodine deficient is the transient form of CH. Every 1 in 3,000 babies are born with CH. It is also 3 times more likely in females than males. The normal biochemical pathway of a thyroid gland includes entry of T3 and T4 hormones into tissues via a thyroid hormone transporter. Specifically, the T4 hormone gets converted into T3 and inactive RT3 by D3 and D1 or D2, respectively, in the cytoplasm. The T3 hormones then enter the nucleus and bind to ligand-binding domain, promoting the binding of a coactivator, leading to the recruitment of polymerase III, and from there, gene transcription is initiated. Congenital hypothyroidism produces little to no T4 hormone, and therefore gene transcription will not occur. Symptoms. In a baby with congenital hypothyroidism, you might observe symptoms of increased sleep and decreased activity. They may have difficulty feeding and have constipation. They may show prolonged jaundice, and its stomach may be observably swollen. The baby may have poor growth and hypotonia, otherwise known as floppy baby syndrome. The largest concern with CH, though, is that it causes neurocognitive disorders in patients who were not screened or diagnosed as a baby and therefore not treated. Previous to neonatal screening, CH was known to be the largest cause of neurocognitive disorders. Screening and treatment. CH is diagnosed by neonatal screening blood test where the baby's heel is pricked and screened for many treatable diseases including CH. Specifically, CH is diagnosed where there are elevated TSH levels and low T4 levels. Remember at the beginning of the video when we explained the connection between the brain and the thyroid gland. If the thyroid is defected, it will stop producing T4 hormone. At this point, the pituitary gland will continue sending thyroid-stimulating hormone, or TSH, to the thyroid gland. However, because the thyroid gland is defected, it will still not produce T4. Therefore, again, TSH levels are high and T4 levels are low. More on treatments. CH is a treatable disease where a thyroid hormone replacement drug is taken by the baby daily. Levothyroxine, which is a T4 replacement, is currently the medication of choice and is taken lifelong. Babies are seen every month for the first 6 months and every 3 to 4 months after that. However, at a young age, children can be tried off the medication to see if the thyroid's function returns. There are also, of course, side effects to this medication. Some side effects include headaches, insomnia, fever, weight changes, etc. Attempts of rapidly raising T4 levels and normalizing serum TSH levels have also been tried. The prognosis for this treatment of CH showed that children who started early treatment with levothyroxine had an excellent outcome where their IQs were at par or similar to their classmates. Scientific advancements. In 2018, a study by Grasberger et al. Discovered an increase of inflammatory bowel disease, or IBD, in congenital hypothyroid patients. Specifically, they hypothesized that there is a shared susceptibility factor between the two diseases. A mutation in dual oxidase 2 gene, or DUOX2, is highly characterized in CH, which is required for thyroid hormone biosynthesis. Researchers have discovered mutations of this gene in IBD patients without congenital hypothyroidism. They also found that patients with transient CH were more prone to having inflammatory bowel disease. Therefore, these two diseases are actually connected. Future directions. While developed countries have a grip on the diagnoses and treatments of CH, it is still a large issue in developing countries. Many of these countries lack screening methods and lack the resources for treatment of CH, where in 2015, only 25% of babies in the world actually had the opportunity for screening, and the other 75% did not. This is causing children to grow up with decreased cognitive development. Future directions of this would be to then discover an accessible way to screen for congenital hypothyroidism by expanding this technology and reducing costs. More specific screening is another future direction, where screening is not a definite confirmation that the patient has CH. There are subsequent tests that must be done to confirm that the patient has CH, and therefore can take time before treatment is administered. Therefore, more accurate results would be important. Also, to discover another drug or treatment that could potentially correct the thyroid gland defects. This would allow the patient to not have to take levothyroxine for the rest of their life and have a medication that would reverse the effects immediately.